stimulates the IGF receptor, and there are dermal fibroblasts. The treatment for this would be weight management and application of topical retinoic acids. Besides this, what is also common is diabetic dermatopathies, which are shin spots which occur all over the shins, the thighs, forearms. There is hyperpigmentation and atrophy. It is more common in elderly men, and there could be multiple lesions. It is a marker for microvascular disease, and there is a high correlation with diabetic retinopathy. So if you see any patient with diabetic dermatopathy, we should evaluate for retinopathy also. Like I said, that there could be some post-traumatic atrophy and post-inflammatory hyperpigmentation and endothelial proliferation, which is why the evaluation for diabetic retinopathy and other microvascular diseases should be there. They usually do not require any treatment. Now, diabetic foot syndrome. This is something which we very commonly see. We see there's a combination of neuropathic as well as vascular complications which occur on the feet of people with diabetes. Day in and day out, we see people coming to us with wounds. It starts with either callus or dry skin, and subsequently there is diabetic neuropathy, there is some vasculopathy. The skin infection proceeds into an ulcer, usually a neuropathic ulcer, which is painless. A lot of times they come without any sensation. They have no pain on it. They could have even walked on maybe burning charcoal or cut themselves because of a shoe bite or a foreign body in the shoe, or things like that. And there usually is debilitating and deforming condition with the progressive destruction of the weight-bearing structure of the bones and joints. Besides that, there also is arthropathy, which is there, which collapses the midfoot, leading to Charcot's joints. So the architecture of the foot also changes. As we know, there's a combination of neuropathy and vasculopathy with atherosclerosis. This leads to impaired wound healing, and subsequently there's an increase in the advanced glycated end products, the pro-inflammatory factors, and oxidative stress. Besides this, there is some damage to the autonomic nerve fibers, which causes reduced sweating, and then there's dryness of skin. And finally, because of the hyperglycemia, there is an impairment in the macrophage functionality. So this increases the inflammatory response and slows the healing of the ulcer. The treatment, we all know, requires a multidisciplinary approach. The sugar control has to be there, the cleaning of the wound, appropriate foot hygiene, appropriate footwear. Besides that, local therapies like hydrogels. We also can give some topical growth factors, antibiotics in the form of either parenteral, oral, or even topical applications. And the underlying ischemia, if it is present, we should consider that maybe surgical revascularization or a bypass. Another thing which is very commonly seen is limited joint mobility. This is also called diabetic gyroarthropathy. This usually occurs in people with long-standing diabetes. There is some scleroderma-like changes. There is the commonly what is seen as the prayer sign or tabletop sign because of the periarticular enlargement of the connective tissue and hyperglycemia-induced formation of advanced glycated end products. Besides this, we also should evaluate these people for as they are at a high risk for falls. So we should evaluate them for autonomic neuropathy. There, however, is no curative therapy for this, but if there is pain, then maybe some anti-inflammatory medications can be given, or maybe topical steroids. But what is very important is the improvement of the glycemic control, as well as the stretching and maintaining of the mobility of the joint. Some exercises should be advised to them. Besides this, we also have diabetic scleroderma, which is non-enzymatic glycosylation of glycogen. Also occurs on the hands, as well as chest and neck and shoulders also can occur. Then Neurobiosis lipoidica also occurs in about 0.3 to 0.7% of diabetes patients. In about 15%, it usually precedes the development of diabetes. It's very common in women as compared to men. Starts as a well circumcised papule, and thereafter it expands slowly with sharply demarcated, slightly depressed yellow waxy plaques with an erythematous raised border. And usually it occurs in the pretibial area. Uh, about 15% occurs outside the legs also. Um, and though we have glycemic control, it still does tend to persist. Some of them respond to on their own spontaneously in about 6 to 12 months. The treatment again could be some local application of steroids or aspirin or pentoxifylline. Then is bullous diabeticorum. This also occurs mostly in men in type 1 diabetics. It's usually confined to the feet. Sometimes it can occur on the hands. It is spontaneously occurring. Usually there is no trauma or infection. There are small blisters which contain clear liquids, and they heal within about 2 to 3 weeks without any scarring. Besides this, we have non-specific changes like ichthyosis formis on the shins of the legs. They're usually large bilateral areas of dryness and scaling. Also, it is called fish scale. This occurs because again of the advanced glycosylated products and microangiopathic stage changes. Besides this, the treatment again is very limited. Any topical emollients or keratolytic agents can be given. Xerosis is also something which is very common, the dryness of the skin which occurs in about 40% of the people with diabetes. It's usually because the skin becomes abnormally dry, there is scaling, cracking of the skin becomes rough, and to avoid complications like fissures and secondary infection, you should apply some emollients. There also is acquired perforating dermatosis, which occurs usually on the extensor surfaces of the body. Pruritus is one of the common symptoms. It is strongly associated with ESRD. And again, the treatment in this is topical tretinoids as well as phototherapy. Eruptive xanthomas also occur, but this is usually associated with hypertriglyceridemia, wherein the triglyceride is above 2000 milligram percent. And lipid abnormalities are seen in about 75% of the people with diabetes. It usually is a first presenting sign of diabetes and can occur at any point of time during the disease. They occur like glossy pink to yellow papules, which are 1 to 4 millimeters, and this usually occurs over erythematous patch. Sometimes they could be asymptomatic, sometimes there could be some pruritus. Again, they resolve with improved glycemic control and reduction of the serum triglyceride levels. Uh, Echordons also, these are usually soft benign fibromas and skin tags which are very commonly seen. The neck, axilla, periorbital areas are where they are usually seen. It can occur in about 3 out of 4 of people with diabetes. Patients with acanthosis also have them in the affected area. The treatment could be either excision or cryotherapy. But what is very important is that the glycemic control is what needs to be done. We also see a lot of people with diabetes having associated pruritus. A lot of them come and they are, just scratching themselves all over. The, of course, affected area could be the scalp, the ankles, trunk, or genital areas. And they usually have some amount of dry skin. The treatment again includes some topical emollients as well as some treatment which can be given. If there is a fungal infection, then antifungal should be given. Then Huntley's papules, these are finger pebbles also, which occur in clusters. They are strongly associated with type 2 diabetes, and topical treatments are usually ineffective. But some of them, if they have excessive dryness, might benefit from applying some emollients. Then keratosis pilaris is also something which is a benign skin disorder. It usually again presents with perifollicular papules with erythema and hyperpigmentation on the posterior surface of the arms or legs, thighs. It occurs more frequently on the skin of people with diabetes. It again can be treated with various topical therapies. Rubeosis facie diabeticorum is also something which occurs, the redness of the face. It usually occurs in newly diagnosed diabetics. It's a sign of poor glycemic control, and it improves with good glycemic control. Then yellowing of the nails and skin also occurs in people with diabetes. Besides this, there's generalized granuloma annulare, which is groups of reddish firm papules which occur, and they are again present all along the trunk, different sizes from zero point 0.5 centimeters to 5 centimeters. Treatment can be done with anti-malarial retinoids or steroids. Lichen planus is also something which occurs in a lot of diabetic patients. They can be treated with topical steroids. Vitiligo is something which occurs in at least 1 to 7% of people with type 1 diabetes. This can be part of the polyglandular syndrome also. They should be advised sun protection as well as topical steroids. Besides this, we have various types of bacterial infections which worsen right from the sty in the eye to cellulitis. Every spectrum of that can be there, and they should be treated locally. Of course, control of blood sugar is very important. Then we have fungal infections. Candida, of course, is the most common fungal infection which occurs. It can occur either in the mouth, the vagina, balanopostitis, paronychia, nail infections. All these things can occur. Of late, we have been seeing a lot of mucormycosis in the last 1 year. I think we have seen much more than what we have seen in the last several years. Then we also have insulin reactions, cutaneous changes which are associated with diabetic medications. A lot of times the patient do get insulin reactions, which could be immediate. They sometimes could have a delayed skin reaction, as well as lipoatrophy and lipohypertrophy also can occur. The treatment for this, of course, is to rotate the site of the insulin injections. So, as we conclude, diabetes affects a broad array of dermatological conditions. A lot of times, the diagnosis of these conditions are very antiquated, and most of the times we find that we are either using some topical emollients or giving steroids. So maybe the diagnosis of these conditions need to be improved, and therefore the specificity of treatment is not really there. Besides this, of course, we need to patient education and lifestyle changes to maintain the blood sugar control, to improve the quality of life. So what is very important is that we must educate our patients as to what is good skin care. Of course, first and foremost is that the diabetes control must be good. Glycemic control should be there, because people who have high blood sugars, they tend to have dry skin. And therefore, because of this dry skin, the ability to fend off bacteria is much less. There is an increased chance of infection, so therefore skin must be kept clean and dry. Avoid taking too much of hot baths, especially in cold weather, and they can use some moisturizing soap, or even otherwise after drying the skin they should apply some moisturizing lotion or maybe a little bit of oil. Care should be taken not to apply between the toes as far as possible, or on the so that otherwise fungal infections are very common. Dry skin should be prevented, so that there is no chapping of the skin and things like that. If there are any cuts, they should be treated right away. They should be taught to report to the doctor, whether the family doctor or as soon as possible. If it's a wound, it should be cleaned, covered with gauze, And thereafter, if there's any major cut, of course, they should see the doctor immediately and get appropriate treatment. Now, during the cold months, the home should be kept more humid, as well as the skin should be moisturized. Like I said, that feet is a very important part of them. Every day they should be checked for any sores, cuts, calluses. Appropriate footwear should be worn, and the shoes should also be checked. With this, I end with this picture. Since you were saying South Mumbai, this is the view of South Mumbai from my yacht.
Yeah, from your house. How can it be from your house, madam?
No, this is from our yacht.
Acha yacht. Okay.
This is the view from the sea, from the
Your
Arabian
private yacht.